Good morning. Glad to be here on July 20th, 2020. So we're going to start into right away some of the things that are going on with COVID. There are now 5,765 positive cases in Escambia County. We're over 5,082 of them are residents. So again, we're over now 5,000 cases of residents in Escambia County. The latest update has statewide shows a 9.6% positivity rate for July 18th. COVID-19 hospitalizations were 217 for July 18th, and hospitalizations 217 Saturday, July 18th, and hospitalizations were 202 on July 17th. And 207 on July 16th. There's a slight typo on dates here. It threw me there for a second. But again, we were at 217 on Saturday. We did not have Sunday numbers from Baptist. There was a slight increase in West Florida and Sacred, but obviously not knowing the complete picture without getting the Baptist numbers. We will have those today when we get everything in. Again, this is all sort of dependent upon people sending in text and certainly over the weekend and emails. If I didn't get one of those emails, we have an incomplete list, but we will update that today for both Sunday's numbers and today's numbers. Again, we went from the 16th, we're at 207. We went down on the 17th to 202, but we were up to 217 on Saturday, and we don't have Sundays at this point, but we will get that out there. Face coverings, just a reminder that a face covering is required, and it remains in effect inside businesses within the city of Pensacola limits and other businesses, other city buildings. We certainly advise it if you're going to be in close contact with anybody, even outside. Certainly if you're exercising, something like that, you're not required to do it. But if you get to a point where you're in a large congestion, we certainly advise it in there as well. Please continue to wear your mask, and again, continue to wash your hands, continue to social distance, and wear a mask. Those are the three things that come out of our conversations with the hospitals. Again, I'll be having conversations with the hospitals again this afternoon at 2 o'clock. Draft budget available online. A draft of the fiscal year 2021 budget for the city of Pensacola is now available online. The budget and brief information guide for citizens. Some highlights of the approximate $236 million fiscal year in budget is that there's no millage increase. There's a balanced budget despite the COVID-19 economic impacts. An estimated $104 million in local option sales tax revenue to cover a variety of items, including $1.4 million in upgrades and refurbishments to some of the city's parks, community centers, and facilities, and $1.3 million for public works and facilities to address citywide ADA improvements, energy conservation and efficiency improvements, intersection and sidewalk improvements, and the continuation of the pavement management program. Also going on right now, we have just a reminder that our resident satisfaction survey is going out. We encourage all citizens to participate and let their voices be heard. City residents are asked to complete the online survey at uwf.edu/HOS resident survey, or by phone at 850-495-2666 by Sunday, August 9th. The city's annual survey is being conducted by the UWF HOS Center. All data obtained from participants will be kept confidential and will only be reported as an aggregate form. So again, please, if you get a chance, let us know what's going on with your information. Also, just for you to know, we are starting back again our employee satisfaction survey. We did that last year. It gave us a bunch of things to go off of. We would have hoped to have been much earlier than this. Obviously, COVID pushed us back from March, April to now July, August. But we are in the middle of putting that out, and so we'll have from our employees and listen to them, and we're continuing to survey them and listen and see how we can continue to make ourselves better in our delivery of services. So that's why we also depend on you, our citizens, to tell us as well. And we will work on all of these things for better service delivery for you. Mayor's Neighborhood Cleanup. Just a reminder that the Mayor's Neighborhood Cleanup will be this Saturday, July 25th, in the Eastgate, Parker Creek, and Palisades area. I think that's Parker Circle area. The Mayor's Neighborhood Cleanup allows residents to clean up areas, to leave items at the curb and clean up on the day of the pickup from the city sanitation services. Cleanup includes bulk items such as household appliances, furniture, mattresses, bicycles, toys, tires, and old paint. Learn more at cityofpensacola.com. Also, some DOT closures and some city closures that we want to talk to you about. Reminder that FDOT, they have closed 17th Avenue will be closed from US 98, which is the bridge essentially to Graffiti Bridge. It began 8 p.m. last night, Sunday, July 19th. That section of 17th will be closed through 6 a.m. Saturday, July 25th. I got caught up in that this morning and came down and got rerouted to Gregory, but again, you can still use it. You can still come to downtown that way. It's just you're not gonna be able to get all the way to the bridge. And we ask that you work with that and understand that it's gonna be happening for the next week. Again, Saturday at 6 a.m. it will be lifted. So again, just this week, please make note that closure will be there. Local traffic on 17th will be maintained, as will access to the boat launch and the visitor center. Planned construction activities are weather dependent and may be delayed or rescheduled in the event of inclement weather. So obviously, right now they're able to get things going because the weather's working, but if something happens, it could potentially delay that. Also want to talk to you about Langley Avenue. And the closure that we are seeing right there. The city is doing a project to create a traffic circle there at Hilltop. It's supposed to be able to get people in and out of the new soccer complex, but also be able to slow traffic down. One of many measures that we're taking to slow traffic down on Langley. Unfortunately, it was our hope and our plan was to keep one lane open and have a detour. That did not work. As we worked with the city of Pensacola, we had people running through the wrong way. We eventually brought police out there. Even with police and traffic trying to work it together, it just was not working. So both parties, and I talked to Chief Leiter last night, and he told me, hey, I made the call. I was happy to do that. I support him in that call. We got to have safety. And so at this point, we've shut down all traffic there and we're rerouting the detour. We ask you to please work with us, slow your speeds, find an alternative opportunity. If you live in the Scenic Heights area at this point, either think about using Summit or Creighton, whichever is easiest for you to use. Langley at this particular point will be worked on. The good news is this should, barring any weather delays, should allow us to move construction ahead of schedule. But again, we ask you to please start thinking of alternate uses to get in and out of Scenic Heights. If you're going back to 9th Avenue, again, we ask you to think about either going down to Summit or up to Creighton and use those streets at this particular time until we can get Langley back open. We will get it back open. This will allow us to speed up construction. But at this particular time, there were too many people trying to do things that were unwise and potentially dangerous. And so we just chose to shut the whole access down at this particular time. Again, construction is going forward, and hopefully when it's finished, it'll be a great finished product for the neighborhood, but more than anything else, we'll get Langley back open. So I ask you to continue to work with us on that. And again, try to find another route for you that would be workable during this interim construction period. Lastly, I know that we also have construction on Bayou Boulevard. I think that is coming to nearing completion. That was part of the project that was going to be putting in some drainage, but we also were able to fix some drainage on that street that we had built up in the bike lane of water. So all of that was being worked on. I really appreciate everyone over in Public Works. I know we're getting close to the end of that, but it's still going as well. So we have a few closures at this particular time, but we're getting all the construction done. We should have it all done up and ready for you. And when it reopens, all of those places will be much safer, much easier for you to use. And we're excited to see what will come with the new work being done. But those are just a few closures and some road construction to be aware of. With that, I would say a couple of things, and then I'll turn it over to y'all. I did just want to say there's a lot of questions still continuing to go on with the issue of the monument. And I realized we last week we discussed a little bit the week before we'd put our 17-page memo in it. I guess certainly realizing that not a lot of people read it or had a chance to see it. So I kind of wanted to elaborate where we were, how decisions were made, and what's happened. There's no doubt that I think from a distance, the statue that we have at the Confederate statue that we have on Florida Square is certainly has the appearance that it is a veterans monument. It says some things about veterans that you can clearly see in big print, and it certainly has the soldier on it. I, like most of you, necessarily didn't see it as a hateful object. I saw this more as a veterans as well. But it's not a veterans monument, and the reason you can tell is when you get closer. And I mean, I'm one of the first, probably over a month ago, that made a mistake on this. I was talking to a citizen that said we had a monument for Jefferson Davis, and I communicated back to the individual that we did not have a monument for Jefferson Davis. We had a monument to Confederate soldiers who lost their lives. Little did I know until I got closer up, and when you walked up and you saw what's on there, that indeed I was wrong. It is a monument to Jefferson Davis. It was a monument to other individuals who I think, as we've seen, what was documented both in the report and through the news journal, used the intent and perhaps mask it with what they were doing with veterans to mask an intent that they intended to display. For those reasons, for me, it was going to be impossible to show the veterans portion without some significant changes. I've been here saying for a long time that I thought that what we could do was better explain it, and give monuments to other people that are here, and if we could find a way to do that. We evaluated that in the process. It ended up it was going to be significantly expensive for us to do it. So we felt like it was the right decision for us to move forward to remove the monument. Many people are also continuing to say, well, this is just you're a prisoner of the moment from what's happening. But I will remind you that in this millennium, which is only 20 of its 1,000 years old, this item has come up about 5 times, 2000, 2006 or so, 2015, 17, and now 2020. This is a monument that continues to have challenges because of that close-up history. And without being able to fairly and equitably tell everyone's story in that space, I don't think it alone can stand there. It's not an issue of what we were doing or trying to erase history. And as many of the council members said, it's not the intent to erase history, it's just the intent to relocate history, because we haven't done a good job of telling the whole story of history. So again, as we move forward with our history, I hope that we'll find some resolution on that. I hope you realize also that, again, there were parts of it that did clearly appear to be veterans and associated with those that fought. But I think if you really get up close to the monument and you really look at the things that were on it, is when I went up close to it and saw that and saw mistakes I made in emailing people. It clearly carried more than just a veterans monument. And the reason I also know that is when we were just talking about trying to find places for the city council to relocate it, we went to the Veterans Park and asked about if they would relocate it there, and they indicated that they did not believe that it was exclusively about veterans. And again, for a number of reasons, it is not viewed as simply a veteran statue. There's other baggage along with it in some of the comments that are on the statue. And I think when we became cognizant of that, we either thought we've either got to figure out a way to include everybody. And if we can't do that, then we need to look at removal. I can assure you that removal was not at the top of my list. I would have rather found a way to tell everybody's story, but I cannot argue with staff. The amount of money, because of the 50-foot height that would have required for us to equitably tell everybody's story, was simply too much. And at that point, we made a decision, the staff made a decision that they recommended that rather than spending a lot more money on our past, we should be spending money on our future. And on that note, I totally agree with staff, and that was the presentation that was made to the council, and they made their decision. We continue to keep moving forward as a community. We have a lot of things in this community, as you probably heard on what we were just talking about, some of the closures. We will stay focused on monies that we can spend on our collected and united future rather than our our different past and certainly our challenges that we've had in telling that story for a number of years. But again, that was kind of a little bit I wanted to do. I've certainly gotten a number of emails out there, and I wanted to sort of lay that out for everybody for a better understanding as to what happened as we went through that. I'm open to questions from you, the press, and so I'll answer those as they come in. Casey?
Sure. The first question is from Jeremy Weekly. Can you address the lawsuit regarding the Confederate monument? What is the city's basic position?
We obviously have had the lawsuit. If you remember, there are both state and federal items that before we got ready to vote. Susan did a great job of looking through those. We don't believe the vote related to remains has anywhere to stand on, and so we obviously will be defending the council's position in court. We obviously know the three individuals who are on the marker, and we know where they are individually buried. And at this particular time, 25, 26 years after the end of the Civil War, we don't have any remains of any soldiers that were buried there. So there are no remains associated with the monument. It is simply a monument that's there. So again, we don't believe, as Susan put it, in both her state and federal statutes don't apply to this particular monument. Along those lines, we are having Susan is having some assistance that was offered. It wasn't totally pro bono, it was a much reduced rate. And so she is working, my understanding, Bruce Partington with Clark Partington offered assistance to her, and she has accepted that at a very reduced rate. I'm sure we're covering sort of their cost, but again, from that standpoint, it was offered to be defended at a very reduced rate, and she took them up on that, and we're moving forward.
And this is from Jeremy too. Have you heard anything from the county regarding a potential mask mandate? Specifically, have you spoken with either the commission chairman or the county administrator?
You know, I have not spoken with them since action last Thursday. I did speak with them prior to that action. The chairman was less optimistic about that. You know, again, we've had our discussions on it. I have my positions. City has its position. County has its position. I don't know that we're necessarily going to change them at this particular time at this position. I continue to remind them that we as local leaders ask for the opportunity to lead. I don't think we need the governor to come in and tell us we have to do something. I think we should be able to responsibly enough to be able to make those decisions. I was on, I know Dave's out there, Dave Dunwoody. I was on NPR on Saturday on an interview, and I was asked several questions about Governor DeSantis, and I commented that I can't believe that every place in the state of Florida is seeing the same and experiencing the same thing. If there's anything, I don't want him to create a blanket condition for everybody. I would rather remind everybody that they need to respond accordingly. And if you are certainly in a red area, you and local government should be making those decisions. We made that decision. I did receive several texts over the weekend from individuals, or I guess Facebook posts as well, from individuals who were small counties that I knew when I was president of the Florida Association of Counties, who were very thankful for the stance I took, because they don't have the impact that we're having, but they totally understand that if you're in kind of a significant hotspot red area, that you and your local area should have the authority to create mask mandates, and that you should do that. And so, you know, I don't want to create a point where I'm telling somebody else who's not in the same condition I am, but clearly in the two-county area we find ourselves in at this point, Escambia and Santa Rosa, we are having challenges. I mean, if you look also to our west, Baldwin and Mobile County are also having the same challenges. They are under a state mandate, but I mean, they certainly should have been doing the same thing in Baldwin and Mobile County. We should be doing the same thing in Escambia and Santa Rosa County. When you look at the city of Pensacola, the city of Gulf Breeze, we have enacted these ordinances. But again, I'm going to be on there today with the healthcare providers, and they've continued to tell me to message a couple of things. One, social distance, wash your hands, wear a mask. So wear a mask is part of it. The other one is if you have been sick and you are recovered, 28 days recovered, 14 days recovered with a negative test, that you please give your blood to One Blood. And I think we have that, Casey, don't we have that on our social media and website where they can go to One Blood to be able to give blood, their plasma that could be used to fight off any problems that people currently have with the disease, and certainly could help with finding a cure or at least a vaccine for the disease.
And yes, we do have that information on our social media. Next question is from Andrew McKay. The Langley closure caught everyone by surprise, especially closing both directions. I'm hearing horror stories about traffic in the neighborhood. Also, when school starts in August, what's the plan for the school traffic?
We will have to work. We did not anticipate this happening, Andrew, this quickly. So that was not our anticipation either. But I think if you heard me talk about what ended up happening with Chief Leiter, we got called out there. The police did. It was chaos trying to happen. Everybody was trying to, we'd set up you can always set up and engineer anything to work. The problem is whether the people actually follow what you put in there. And we had many people that were trying to run the stretch through the wrong way, which was potentially dangerous, and just a variety of things. We tried some different other options, but because of the way you can't really go south around Langley, you can only really go north around Langley. There was no real way for us to work it. It was not anticipated to close in both directions at this point. We're about 10 days earlier than we expected, but we felt like if we went ahead and did it, it would help us get the construction done faster, and we'd be able to open it back up. I don't exactly have the date. And Casey, I don't think gave me the date exactly this morning of when they think they'll be done. So I don't know if we'll meet the school at this particular time. But again, I think we would advise everyone that they begin to figure out different ways that they can either get to Summit, or if they can get to Creighton, whatever's the easiest way for them to go, to begin to get out of there. This is a temporary problem. We will get this fixed with some construction. Obviously, right now at Perry and Bayou Boulevard, we're having some of the same problems. They're creating detours. We're going to be finished there soon, and that'll fix up. This one will eventually be finished. This isn't a huge construction job. We should be able to get this done. We're having the same thing happen in the middle of beach season at 17th and the bridge. So these are things that happen with construction. Progress creates temporary problems. We ask you right now to go out and try to find a solution. We've put together some ideas that we have in the detour. The main thing is we'd ask you to please try to keep your speeds down. And again, try as fast as you can to get to a road that is more suitable for that kind of traffic, whether it's going all the way down to Summit, whether it's going up to Creighton. Those streets were made to handle things like Langley, and we're just continuing to work through it.
And I think right now the anticipated completion date of that is October 8th. It was about a 90-day project from when it started. So the next question is from Andrew McKay as well. Is work on the soccer complex itself going to come after the roundabout is done? And what's the expected finish date?
We're going to be working on that. We had so our bids came out significantly higher than what we expected. So we're coming back and looking to see what we can do and put something together. The good news is I was just talking to I was out this morning when I was walking, ran into some people that were very involved in youth soccer. We were talking about it. Obviously, what it looks like this year is probably much of our fall season is going to be lost due to COVID. I think our goal is to try to have this ready to go for spring, and it works out well. We'll have the construction done, we'll have the fields done, and we had COVID, so hopefully by the spring we will get out of COVID, and then we'll have the road done and the fields done. And again, it wasn't our intention to go this direction, but it looks like it may work, and everything may come together at the right time, dealing with COVID. But again, the construction part of it, we knew was going to happen. The construction part of it not only serves the soccer fields, it will ultimately slow traffic down Hilltop and Langley there. When we were in the middle of doing this, Keith and Kareth and I went out and took a look at that intersection. We actually went and talked to the people on the corners, and it was amazing to hear them tell stories of wrecks and other things that happen on that corner because of the way the actions people take and generally driving through it too high of speeds before they realize they have to take the corners they do. So again, I think when this is done, this will be so much safer for everyone on Hilltop, everyone on Langley, and again, everybody that drives those stretches. It'll create a slowed down atmosphere at this point. Obviously, we're just going through the difficult point of getting the construction done.
And Brian Cooper is telling me that there's a pre-bid meeting tomorrow for the soccer complex, and then of course we have to advertise and get bids and hope to have it completed by March 1st. So
just in time for spring soccer, hopefully to come back around, no COVID.
Yep, here's hoping. And the next question is from Jeremy. Is the city in the red now?
I mean, we are technically in a yellow. Our city staff isn't back to green. We've actually moved ourselves back into green. This has been an incredible job of management. When so often I'm the one that's standing here and discussing and talking with you, but I don't have a chance to really tell you about some of the things that are going on and the people and the work that they're doing. I tell you the job that both Chief Leiter and Chief Craner have done with their two organizations, who are they're the tip of the spear for us. What's happening right now with Brian Cooper in Parks and Rec and Derek in Public Works, John Pittman in Sanitation. All of these areas are working diligently to make sure that we have enough people and enough bodies to do the work we need to do. At this particular time, we, as the city of Pensacola, the actual organization, are in the green. But as a city as a whole, we find ourselves in yellow because of our hospitals. Again, I look forward to 2 o'clock. I mean, our hospital execs haven't told us we're necessarily red at this point, but they agree that we are solidly in the yellow, and there are challenges facing each of their hospitals as they try to figure out what to do. This is the reason we're asking all of you. This is the reason we think it's a 2-county area. When 50% of the people wake up in the morning from Santa Rosa County and come to work in Escambia County, it really is a 2-county issue that we've got to work together on. We've got to do everything we can to get our numbers down so that our hospitals will not get overrun. That's the whole purpose that we did. We got into this in the starting process. This is what we're trying to stop and achieve. We're trying to stop if you get in a car accident or something else, we want to make sure that when you get there, there's enough medical service there to service your needs. And again, I'm told at this point that we're in the yellow, that we can totally do that, but we need to be very concerned about where COVID is. And we should be taking all actions. Every one of us as a citizen of the 2-county area have the ability to help. And that includes washing your hands, socially distance, and wearing a mask. If we do all 3 of these things, we should be able to see our numbers come down. Again, it'll be interesting on Wednesday to see where we are. We're starting to see a little bit of flattening in hospitalizations. We're still having increases, but we are seeing flattening that's not as steep as it was at one time. But there's no doubt we're still seeing increases. So we just got to continue to do what we're doing, and things that we've asked you to do. We please ask you that you comply with us.
And this is from Daniel at WKRG. Is the city moving forward with finding a contractor to move the monument despite the lawsuit?
We are still looking at all those things. Absolutely. We communicated to the council that it could be some time because there are only a handful of people that do monuments, specialize in the historic value of monuments of this size. They're kind of all over the Southeast right now. A lot of other cities, in fact, in a lot of ways, Pensacola probably is one of the last to make the decision on its Confederate monument, but so that's kind of put us a little bit behind the curve. But we are working to make that happen, and we think that can be parallelly done with the lawsuits. So as those things are working, we can continue to keep finding the answers we need, so that should something happen, the injunction be broken, we will be able to move forward in that way. At this particular time, we're obviously letting the court decision happen out. We understand absolutely the judge's decision. When somebody comes in and claims they have an argument, that argument needs to be heard, the decision needs to be made, and the city will comply with whatever decision comes out of the court system.
This is from Jeremy. Any plan on reopening community centers?
I would say not at this particular time. And y'all can't see Keith, but he's shaking his head at this time, looking at me, so I mean I know that's the case. I don't think. We made a decision to close events all the way through August 31st. I think you'll see us keep our community centers closed through August 31st. As we said before, if you remember back in May, we talked with you very clearly on this. We believe that every effort should be made to keep businesses open. The city should not create any additional challenges or likelihood that this virus would spread further and create complications that might close businesses. I mean, our first number one priority is to our health of our citizens and our community. Our second priority is to the economic well-being of our community and what's happening with its business. So we're not going to allow any particular thing that we do with the community center unless it deals with the overall health of our community. Things like feeding programs will continue to go on. Things of those nature. We've got a number of efforts happening at all of our centers, whether it's dealing with the elderly or whether it's dealing with those that are very young and school age. We will continue to keep doing our work that we're doing with feeding. We also, I think, United Way of Victory will continue to do things that they can do with daycare for first responders and things. So anything that deals with the priority of our health, I see continuing to do. But otherwise, we're not going to open or do anything at our community centers that would jeopardize and create either jeopardize our health or jeopardize our economy. We absolutely want to be keeping as many things open as possible. We want you to be able to go to as many stores as possible and retail, but when you do it, we want you to do it with a mask. That's got to happen. And again, I will say one thing, I'm continuing to see more businesses, even in the unincorporated area of the county, require masks because they feel like it's the right thing to do for their business and the right thing to do for their customers. And we would simply echo that decision.
And this is a follow-up question from Andrew about the soccer complex. I believe when we were talking about that earlier, he was asking about the cost coming back higher and how much higher.
I'm thinking we were about 500,000, Keith, higher than he's going to look at me. So I don't have that number sitting right in front of me. So, Kareth, are you nodding correctly? Is that what we were?
Yeah, I think that's where we were, somewhere around there.
We were about 500,000 more than budgeted. Obviously, where our LOST stands at this point, any overrun is a huge problem for us, and we've got to rethink ways that we can pull those numbers down. So Brian is continuing to work with that. Gareth is working with it. At this point, we've just LOST is probably the hardest hit area that we've been with COVID, and so at this point, I don't think we can really. We've got to do everything we can to get that project back within budget. But the good news is it turns out the time we lost and what we thought we really wanted it to complete to start the fall soccer season, we're not going to be starting the fall soccer season. That's pretty clear. Like I said, I talked this morning with some people. They would like to be able to do some clinics, some other things, but they agree that they felt like it was unreasonable. They didn't want to risk their own kids or other kids during the soccer season this fall. So we're going to shoot for spring. And we're going to wait as long as we can on some other choices for some other sports and our kids' athletics. But we, again, have closed everything through August 31st. So at this point, our community centers, our fields for youth sports are going to be closed through the 31st of August. I believe there are some sports, some softball. When you look on that scale, softball was one of those things that seemed like it had fairly good social distance. So at this point, the decision we talked about was keeping that open and letting that season play itself out. But things that are indoors, volleyball, basketball, we have, those were rated as very high probability of spread. So we, talking with Brian Cooper, we have made a decision not to open those sports at this particular time. And we hate it because we know there are a lot of kids out there that participate in this and depend on this. But at this point, it's just been too risky for us to open it and create a risk of exposure and spread.
All right, I don't see any new questions, so I think we are wrapped up here.
Well, good. Thank you very much. We will get back. We will have you back the information that you need on the numbers once we have those for both yesterday's numbers and then today's. We should have that by noon. Again, I don't know if there was a challenge yesterday with one of the people that usually sends me an email if they were off or other things on the weekends. It's sometimes hard to get information, but we will update you as soon as we have that information. We are speaking with the hospitals today at 2 o'clock, and I will be doing a Facebook Live again on Wednesday. So from this point, again, we'd ask that you continue to follow the things that we're doing, ask you to socially distance, wash your hands, and wear a mask. If you can do those three things, we think we can make a difference, and we ask for all of you to help. Thank you very much.